Hey, good, happy late morning, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, your Wellsway affiliate right here in Yorkville, Illinois. Welcome, everybody, to this week's live broadcast. I apologize. I'm going a little bit early right now, only just to save a little bit of time at the end. Normally, I know I go a little bit later at 7:30, so we're going to see a lot of people that will be catching the replay. And if you are, just make sure you let me know where you're watching from and go ahead and hit replay or type in replay when you respond. Again, welcome everybody. I hope you guys had a great weekend. I hope you guys are enjoying the new fall and brisk weather, especially up here in Yorkville, Illinois, where we can enjoy 4 seasons within a week span. So guys, I'm going to go over an interesting topic today. I'm going to talk about breast cancer and how it should not be a surprise diagnosis. And if it is, it just means that your doctor has led you down a very wrong path. And I'm going to explain to you why. And so hopefully over the next 40 minutes or so, stick with me. Hopefully this will make a lot of sense. And also some things that you guys should be doing instead of things like mammograms and mastectomies and things like that, okay? Before we do that, we had some people ask about this actually coming up tomorrow on Tuesday. We're going to be doing a breast thermography in our office, and I'll go over this in just a little bit and explain to you why. But for those of you, I know that the schedule might be full or not, but if you are in the Chicagoland area and you want to actually have breast thermography, which I actually recommend over mammography in my opinion, because it is least invasive, doesn't cause any kind of trauma to the area, and it can be a wonderful baseline as far as tracking versus doing your annual mammograms every single year. Because remember this, guys, is that if there's any kind of tumor activity in the breast, squeezing down on it and then blasting a bunch of radiation directly into the breast tissue, you do it long enough and it will cause breast cancer. So we'll be doing thermography. All you have to do is just go to IllinoisThermography.com. You'll see our location on there, and then you can contact Cindy, who runs it, and see if there's any availability in regards to that. But this is something that we are going to be considered doing over, something like 3 times a year approximately, or something like that, just to make sure that people can get their baselines and can get their follow-ups accordingly. Okay. Now, also, guys, if you haven't registered for this event coming up, this is going to be Saturday, October 7th. I'm going to be talking about, guys, how the immune system works from a physiological perspective, how it was designed, and how actually doctors do it completely backwards when it comes to the immune system. We're also going to be giving you our updated information in regards to the COV, et cetera, the COV, et cetera, quote unquote vaccines, and we'll also go over some new things in regards to understanding and knowing your rights when it comes to health freedom as well. This was a wildly popular event that we did last year. In fact, I think we had to do it 3 times just because the number of people that wanted to come to it. And so we're going to be updating it. It's going to be bigger. It's going to be better, because once you understand how the immune system works, once you understand how the immune system was designed, you're going to realize that a lot of things that actually the medical community does not make any sense whatsoever. We're actually going to be using medical physiology. We're also going to be using peer-reviewed journals to understand how to build a sufficient immune system response and how to test those different parts of the immune system the way that it's supposed to, which actually leads me into saying, hey, when you talk about breast cancer, it should not come as a surprise. Why is it not coming as a surprise? Because if you were testing things, you would start to see trends take place. If you were testing your immune response, if you were testing your estrogen metabolism, if you were testing your inflammatory markers, it should not come as a surprise. But in the medical community, it's just don't worry about anything until you get to be 50 years of age, and then let's start radiating your breasts and try to see if there's some kind of tumor that's there. And guys, if there is anything suspicious, of course, they're not going to be testing in detail like we are, but you keep radiating it every single year, and then finally you will have a breast cancer diagnosis because the radiation will contribute to it, and then you'll thank the doctor for doing a mammogram in which maybe the mammogram actually caused it. So guys, I want you guys to understand something. Again, I'm going to show you a different perspective when it comes to breast cancer, is that breast cancer just doesn't happen. You just don't go one day of being cancer-free, and then you don't go the next day of having stage 3 breast cancer. So these things develop over time, and so cancer isn't just something that just jumps into your body and you're cancer-free one year and then the next year your body is riddled with cancer. It doesn't work that way. And so I want to always tell you that breast cancer doesn't just happen. Gastrointestinal disease just doesn't happen. Heart disease just doesn't happen. It's not like you go get a clean bill of health and the next day your father dies of a heart attack and say, wow, he was in such good health. No, he wasn't. It's just you weren't investigating properly as far as what was going on. And so this is so important because remember, a lot of times in medicine, they're just testing for fires, but they're not testing for causes. We don't test for fires, we're testing for causes. So it shouldn't come as a surprise, and it just doesn't happen. Something that you need the right physiology, you need the right type of hormone metabolism, and you need a lower immune response for breast cancer to happen. So when we say that, it's not like it just jumps into your body all of a sudden. So I want you to think of this. Why are there so many women who are having problems with their female tissues? You talk about the breasts, talk about the ovaries, talk about the uterus, and these are things that are actually responding to estrogens. So the first thing is our kids, our girls and boys, are growing up on an extremely high sugar diet. Guys, these things are things that cause problems in the liver, that cause inflammation, and can change your hormone metabolism, okay? Number 2, once a girl starts having problems because of inflammation, high amount of sugar, high amount of stress, all of that is going to change, cause the body to adapt, and then they start to have issues when it comes to their menstrual cycle. And so rather than actually test the hormones, rather than actually test for the triggers, rather than test for the causes, is just go on birth control, which is actually a hormone. It's a hormone interrupter is what it's called. It is not, these things are not just benign. These things are not just, hey, there's no side effects from doing it. They're endocrine disruptors. So we put a lot of girls on birth control. They may have problems with acne, go on birth control. Problems with their menstrual cycle, go on birth control. They may have problems with, like you name it, and it's just go on birth control. And guys, what's so interesting is I really think that birth control is one of the contributing factors to an increase in breast cancer over the last 30 to 40 years, as well as hormone replacement therapy that was given to women after menopause. And then on top of that, high amount of antibiotic use, changes the microbiome, it changes everything because, guys, everything can affect everything because of the Swiss watch principle that we talk about so much. And then, you have your routine mammograms that are supposed to start at a certain age. And then finally, you get your breast cancer diagnosis, which you do chemo, radiation, and surgery. Then after that, you're supposed to go on aromatase inhibitors, which actually can contribute to ovarian cancer as well. And then basically what they say is you are quote unquote cancer-free after you have a 5-year cancer-free diagnosis. It says, you know what, don't worry about it. But I want you to remember, they're just going to say, well, now we're just going to watch. Watch for what, doctor? Well, we'll just keep testing you and watch for the cancer return. Guys, if you never change your hormone physiology, if you never change your immune system, if you never change the oxidative damage that's taking place inside the body, then all you can do is you can cut it, you can poison it, you can burn it, but all that did was lower your tumor load, and it didn't take care of the physiology that caused the cancer in the first place. Give me a thumbs up if you agree with that. So it just doesn't happen, guys. And in fact, here's what's interesting on the idea of birth control. This comes from the Susan G. Komen Foundation, which I have a lot of disagreements with. But here's what they actually talk about birth control pills. And I want you to listen to their language. As they say, current or recent use of birth control pills as oral contraceptives, otherwise known as, is linked to a slight increase in the risk of breast cancer. Studies show that while women are taking birth control pills and shortly after, the breast cancer risk is 20 to 30% higher than for women who have never taken the pill. However, extra risk is a fairly small impact because the absolute risk of breast cancer for most young women is low. So even if those who have a slightly higher risk are unlikely to get breast cancer. So what they're saying is they're saying that your cancer risk is 20 to 30% higher. However, it's really not that big of a risk because you're young. So what they're saying is well, you're young, so you're not going to get it like right now, but what they're not telling you is even actually taking long-term oral contraceptive use, is it actually causing a problem? Okay, let me say it again. Is it actually causing a problem down the road? Because remember, breast cancer just doesn't happen, okay? Now, once women stop taking the pill, their risk of breast cancer begins to decrease. Well, I wonder, is it the actual pills, the estrogen metabolism? Is it taking these hormones? Because remember, progesterone also is an immunosuppressant as well. So they're actually saying if you get off of the birth control pill, actually your risk of cancer goes down. So what they're saying about birth control pills is basically this. Well, we're still looking into it. Guys, this is the same thing with the COV, et cetera, gene therapeutic, is they're looking into it. I just read an article about how their efficacy of the actual gene therapeutic, and they're in the end of the trial, phase 1, 2, and 3 trials, which are going to end in October. That's interesting because the clinical trial is actually the U.S. population. Isn't that interesting? Which means that you're the guinea pig, and then also if you're taking a birth control pill, you are also the guinea pig. All right? So breast cancer, first and foremost, is not caused by estrogen. Now, a lot of times people will say, well, Dr. Nate, you're a man. Why are you talking about this? Well, you can be a man, you could be a woman, and still understand physiology. And so I hear this argument a lot is, how can you talk about things involving women when you're a man? And it's like, because physiology does not have a gender, okay? So breast cancer is not caused by estrogen. And in fact, if you're saying that, you shouldn't have an opinion because you're a man, and yet you still call this hormone known as estrogen, you still call it my estrogen levels, then you actually don't know what you're talking about. Because there is no such thing as a hormone known as estrogen. And in fact, estrogen is a broad term that describes all of the different types of estrogens. How many of you guys knew that you have more than one type of estrogen? So you have estrone, estriol, estradiol, and then you have its derivatives on 4-hydroxy, 2-hydroxy, and then 2-methoxy, 4-methoxy. You have all of these other derivatives of estrogens especially. But I want you to tell you something, is that breast cancer is not caused by your estrogen, okay? It's not caused by it. Just having that hormone doesn't give you breast cancer. But instead, breast cancer is caused by abnormal hormone metabolism. And what metabolizes these hormones in the liver are known as enzymes, which means that your body has to build these enzymes, and you need nutrients for these enzymes to be able to be built, but you also need proper undamaged DNA, okay? So the inability to be able to repair, okay? This is called oxidative damage. And then number 3, it ultimately comes down to a failure of the immune system. So let me ask you a question. Is your doctor testing your hormone metabolism? Are they actually testing your oxidative damage? Are they actually testing your glutathione levels? Are they actually testing the immune system? Because when you start testing this, you will quickly start to see truly what is your breast cancer risk. And that's why I say that it shouldn't come to a surprise, okay? So when you talk about breast cancer, it's almost like this. One of the first things when we talk about this top one, abnormal hormone metabolism. Well, where is this actually happening? It's happening in the liver, okay? So you ask people, what does your liver do? They're like, I don't know, it like detoxes. Your liver is doing hundreds of different types of processes in the body. Yes, it is involved in the removal of toxins. Yes, it is involved in hormone metabolism. Yes, it is involved in glucose metabolism. Yes, it is involved in a lot of other things as well. But I want you to think of this, is that, you know, people throw around this whole detox concept around, and I don't think they really understand actually what it is. yes, your liver does detox. Yes, it does it for free. But however, is that if you are becoming deficient in specific enzymes for detox, and you're not able to feed those pathways, then you are not going to be able to detox as efficiently. On top of that, maybe you are feeding into those pathways the way they're supposed to, but the amount of toxins that you are consuming is more than your body's ability to be able to detox, okay? So this is why when people start to poo-poo the idea behind a detoxification, they say, well, your liver does it for free. And I say, yeah, it's supposed to, but we're also exposed to a lot more toxins than we were. We take a lot more medications. We have a lot more heavy metal exposure. We have a lot more glyphosate exposure than we did. We have a lot more exposure to specific herbicides than we used to 200 years ago. And so what actually helps to keep this bucket empty is to, yes, limit the amount of toxins that you're consuming, but also make sure that your liver enzymes are being fed so that you have the ability to be able to keep this bucket empty. When the bucket gets full is when toxins is greater than your body's ability to be able to detox. That's it. So, and the liver is where you're going to start to see that specifically. So when you look at your body's ability to be able to metabolize your estrogens, this is actually known as a Dutch test, okay? And so one of the things that you got to look at when you look at a Dutch test and you start seeing how you're metabolizing your estrone, estradiol, and estriol, you can see how it is going down, these pathways being metabolized by the liver and excreted by the kidneys. Now, this pathway right here has to do with a breast cancer type pathway, and the reason why is because this 4-hydroxyestrone can actually bind to the DNA and to damage the DNA. So would it make sense that if you were worried about your breast cancer risk, or if you were worried about breast cancer risk after you've already had breast cancer, to be able to measure this because it's the one that is damaging the DNA of the breast tissue? Now, if you look at this person, what's interesting is this person already had breast cancer, already went through treatment. So you can see she was on things to actually lower her estrogens in general, but even despite that, when you look at this, you can see the percentage of this 4-hydroxyestrone, and she was at 24%, when in reality, you should be at about 8 to 9% of this type of estrone metabolism. So even though they cut, they poisoned, and they burned, and they gave medications afterwards, she was still had problems in the liver that was causing abnormal metabolism, that was still causing oxidative damage of the DNA of the breast tissue, okay? Now, so you can see that that pathway is still wrong, and the reason why is there's nothing that you can do to cut, poison, and burn something to change the physiology for the better. And I always say, yes, sometimes you do need to do it in order to lower a tumor burden, and there's tests that you can do in order to determine that. But just remember this, how can you become healthier by making yourself sicker? So hormone metabolism is in the liver. You can actually see things that will damage the liver. Inflammation, smoking, polyaromatic hydrocarbons like plastics, pesticides, and certain pharmaceuticals, having a high sugar diet, which will inflame the liver, and also alcohol consumption. Now, a lot of times when a doctor says, well, don't smoke and don't drink too much and, whatever, and you're like, but doctor, tell me exactly what I need to do. And they're saying, well, just like don't smoke and eat lots of veggies. It is the most basic thing that even a 4th grader could tell you. And the reason why is because medical school, heck, even chiropractic schools, are woefully inadequate when it comes to teaching people about lifestyle. And this is clear across the board, especially in the healing arts. So all of these things can wreck metabolism, and the reason why is because not only can it cause oxidative damage, but it can actually interfere with specific enzyme activity of that specific hormone metabolism. Now, number 2, when you talk about oxidation or damage to the DNA, then what happens is that these cells can become cancerous once they have specific damage to specific genes. The specific gene is actually the p53 enzyme specifically that is programming cell death, otherwise known as apoptosis. So when you look at a cancer cell, it's lost the ability for programmed cell death, which is why it keeps replicating and it never dies. So when you are getting more damage to your genes than you are able to repair, then what happens is now you are damaging genes that can now lead to cancer. So cancer happens when damage is greater than the body's ability to be able to repair. And this is why, guys, if you've ever heard of antioxidants, there's nothing special. All they do is pretty much neutralize free radicals that can actually cause oxidative damage to your DNA. So antioxidants. So you can actually measure these things. So what causes the inability to be able to repair? Nutrient deficiencies. Do you actually know what they are? This is one of the reasons why, guys, we don't do a nutrient deficiency test. And the reason why is because your health is not a this for that. You do not go in and just measure your B12 or measure your B6 or measure your zinc or anything. Because a lot of times it's actually an absorption issue. You just don't dump a bunch of more of these antioxidants in because a lot of them need, for example, proper stomach acid, which those things are never ever going to touch a nutrient deficiency if you don't have enough stomach acid. But number two, can you measure glutathione? Absolutely. So people can be extremely deficient in glutathione, which is actually one of the things they consider the body's master antioxidant. And then also your melatonin levels. Guys, these are things that you can actually measure on a Dutch test. So a Dutch test will measure glutathione levels, and it will also measure melatonin levels. Melatonin is another master antioxidant. And guys, people think melatonin is your sleep hormone. It's your antioxidant hormone. And this is why if you are scrimping on your sleep and you're not getting, ladies, 8 to 9 hours from 10 o'clock until 6 or 7 o'clock in the morning, why you can become very melatonin deficient, and it can create a lot of oxidative damage specifically to the mitochondria, and it doesn't allow for the cells to be able to heal and repair. So the more that you skimp on sleep, the more you are inhibiting repair taking place inside of the body. So you can measure this on a Dutch test. You look at this person, we measure glutathione, and guys, by the way, you can't really take glutathione because it is such a large amino acid, it needs to be broken down in order to cross the gastrointestinal barrier, but you can actually give the constituents of glutathione, okay? So, because I know that all of you are Googling, how do I get a glutathione supplement? And then, so you can see on the low end of range. So this is actually after the actual test, you can see, was actually left very deficient in glutathione as well. So, glutathione in cell cancer death. This comes from PubMed in the peer-reviewed journal known as Cancers, March 2011. They said glutathione in cell cancer death. This review finally analyzes whether glutathione depletion may facilitate cancer death under in vivo conditions and how this can be applied to cancer therapy. How interesting is that? Now, the last thing is going to be a failure of the immune system. Guys, your immune system is ultimately your backup, because even if you are producing a lot of what's known as 4-hydroxyestrone, and it is causing oxidative damage, and even if the cell turns into something like cancer, well, ultimately your backup is your immune system, because you have specific cells that are responsible for tumor suppression. They're known as your CD8 cells, and they're also killing off virally infected cells and also cancer cells. Virally infected cells and cancer cells will throw up a flag on their membrane that these cells that are surveying the area, if they identify that it is now a cancer cell, it will inject its cytotoxic protein into the cell and effectively killing it But remember, you also need other immune components in order to clean up that cellular debris known as granulocytes or neutrophils. So when you look at this, guys, it's like you can measure if you are making different types of immune cells. A lot of in your basic CBC, they'll measure just these things, but what they don't measure is these things below, which is on our expanded lymphocyte enumeration. This is all produced within your bone marrow. Interesting enough, one of the things that will kill off these stem cells within the bone marrow is, in fact, chemotherapy. So you have your T lymphocytes and your natural killer cells, which are responsible for virally infected cells and also for surveying for tumor suppression. And how many of you have actually gotten this measured prior to cancer? How many of you are even getting it measured after cancer? Because who is trying to change the physiology that brought it on other than cut, poison, burn, suppress your hormones, and then retest every single year with no change in the reason why it happened in the first place? Now, what's interesting is, guys, even when you look at what's known as a CBC with a differential, which maybe your doctor is running that one time per year but not doing an expanded lymphocyte enumeration, this also comes from PubMed in breast cancer treatments. This is September 24th, 2022. Interesting enough, just a couple of days ago. They said the clinical significance of the neutrophil to lymphocyte ratio in oligometastatic breast cancer. Okay, so this neutrophil lymphocyte ratio was an independent prognostic factor for overall survival of oligometastatic breast cancer. Basically what they said was they said the more lymphocytes that you had also in that subset is known as your CD4 or CD8 cells, also your CD3 cells, CD19 cells, and your CD4 cells. But within that subset, if that was higher, this was a good indicator of survival of cancer. Imagine that, meaning I have a stronger immune system and more cells to be able to handle a tumor, and I'm going to survive longer. But now they're looking at that because the lower inflammation that you have, because if you start having high inflammation, you're going to have high neutrophils, and a higher tumor suppression is going to give you a better survivability of cancer. Imagine that, what we talk about all the time about lowering systemic inflammation and then helping the immune system to be able to recover. It's a novel idea, isn't it? That the body has the ability to be able to heal itself, and it does not need help. It needs to not be interfered with, but we interfere with it from birth all the way until our death. So this right here is a expanded lymphocyte enumeration. So this is actually someone after breast cancer. What do they have low? Your CD3 cells. Basically, these are all of your mature T cells in the body, like your CD4 and your CD8 cells. You can see low in the CD4 cells. These are basically the generals that are coordinating an adaptive immune system response, which are absolutely critical. You can see low in B lymphocytes to be able to produce antibodies, and then actually low in overall white blood cells, which makes a lot of sense because when you do chemo, you're going to kill off all the stem cells within the bone marrow. And this is after treatment, and this is the first time that anyone has ever looked at this or even tested this. So you can see they are immunocompromised after treatment, but not only that, they're still metabolizing a high amount of estrogens down bad pathways that's continuing to cause more oxidative damage. But here's what they do now. You know what? I think if we just cut off the breasts, it's going to take care of everything. No, it won't. It will not change the expression or the physiology that caused it in the first place. And in my opinion, it's no different than if they're saying to prophylactically cut a woman's breasts off. It's like saying, you know what, I don't want to hear my baby cry. I'm just going to cut the tongue out. Problem solved. It's the body's way of saying something is wrong, and I am in need of healing in through that area. And so if we would stop seeing it as some kind of sickness and a response instead, we would much more likely want to get to the reason why it was happening in the first place. Now, here's what's so interesting, guys. These are just 3 articles. I'm going to read this to you. The effects of AHCC, a standardized extract of cultured, basically a medicinal mushroom, on natural killer and T cells in health and disease. Activated hexose correlated compound, AHCC, inhibits the proliferation of ovarian cancer cells by suppressing signal transducer and activation of transcription activation. Alleviating effect of active hexose correlated compound, AHCC, for anti-cancer drug-induced side effects in non-tumor bearing mice. So what is this? This is the role of specific medicinal mushrooms and their ability to actually fight cancer. And I did an article, or did a live last week about how it can actually help with chronic viral infections, things like herpes, or things like Epstein-Barr virus, or things that are responsible for like cervical cancer, for example. And so it has the ability to be able to not only suppress the genetic expression of it, but it also has the ability to be able to completely inactivate a virus. But not only that, it feeds into these responses to help increase some of those cells. Now, I know a lot of you are saying, I need to take this, I need it. Well, how do you know whether you need it or not? You test. So we never give anything to anybody unless the test deems it necessary. And in fact, there's many tests that will deem it necessary, and they're like, why are you giving it to me? Because I say, you don't need it right now. We need to handle these things actually first, okay? Which is why you would think that if someone was on 36 supplements, why they should be incredibly healthy, but actually some of the most sickest people that come into our office are already on 18 supplements. Because Dr. Oz says that it's good for them, so they take it. And I'm like, well, I understand why you're taking it, but you need to do things in the proper order, okay? And so this is why there's a lot of cases of people going to functional medicine doctors and not getting any better, because a lot of times, guys, it's just a this for that approach rather than understanding how the whole body starts to work together. Now, I want to talk to you about mammograms, okay? Because, the whole narrative is get your mammograms, get your mammograms, get your mammograms. And this comes from Breast Cancer Research, May 2015, the benefits and harms of mammography screening. So here's what they say, okay? Here's what they say, peer-reviewed journal. So using a United Kingdom population data of 2007, for 1,000 women invited to biennial mammography screenings for 20 years from age 50, 2 to 3 breast cancer, 2 to 3 women are prevented from dying of breast cancer, okay? So basically, in order to be able to do this, is that the efficacy is basically 1 in about 1,000 or 1 in 500, okay? So 1 in 500 is mammography is actually lowering your risk of dying from breast cancer. All-cause mortality is actually unchanged, okay? Overdiagnosis of breast cancer is the main harm of mammography screening. Based on recent estimates from the United States, the relative amount of overdiagnosis, including ductal carcinoma in situ, which is actually not even a stage 1 breast cancer, it is below, it's like stage 0 breast cancer, and invasive cancer is 31%. The results in 15 women overdiagnosed for every 1,000 women invited to biennial mammography screening for 20 years from age 50. So basically what they say is it prevents death in about 1 in 500, but out of those 1,000, 15 women are overdiagnosed, in which they now go into the medical system that is based on cut, poison, burn, and fear. So to me, that doesn't sound like a very inviting proposition to want to go get my mammogram. However, here's what their conclusion was, and I agree with it. They say this: women should be unpassionately informed about the benefits and harms of mammography screening. What does that mean? Is that a doctor should say, here's the benefits, here's the risks, you make the decision. But it's called an informed decision. It's called an informed choice. Are we given an informed choice when it comes to mammography? Are we given an informed choice when it comes to, lumbar and cervical disc surgeries? Are we given an informed choice when it comes to vaccines? And the answer is no, 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 and no. It is do this or you will end up in a wheelchair. Do this or your child's going to die. Do this or you're going to die of breast cancer. And in reality, the statistics do not support that whatsoever. But just remember is that a surgeon will cut, a pediatrician wants to vaccinate. That's just what they do. But in reality, we should be informing women and unpassionately saying, here's what your choices are, versus scaring a patient and putting them into an unnecessary state of fear. Because guess what? Why? Is because it's non-invasive. Basically, they take a picture of the breast tissue. Areas that are going to be hotter are going to be a sign of inflammation and higher metabolic activity. And the third thing that I will always say is this, is that if you have something that is questionable, or if you've already been diagnosed, stay calm. Because this just did not pop up all at once, and you had time in order to make an informed decision. And so guys, this is why tomorrow, coming up, we're going to be having breast thermography in our office. And if you're from the Chicagoland area and you want to do that, please go to IllinoisThermography.com and you can actually register with Cindy to get a thermographic scan. I don't know exactly because we're not really handling it. It's just going to be in our office. I believe that the cost may be $200 and $250. And the cool thing is that it will come with a report. And if you need to follow up after that, or if you are getting a baseline every 6 months to a year, again, you'll start to see changes in the physiology so that you can start to address it before it turns into something suspicious. But ultimately, just like I said, guys, is it comes down to your immune system. And I am always surprised that parents, they don't know how the immune system works. Even a lot of doctors don't know how the immune system works. Just people in general don't understand how the immune system works. And this is why coming up October 7th, we're going to take the time, myself, Dr. Brian, and we're going to teach you how the immune system works. We're going to show you actually why. You'll see if you understand physiology, a lot of what doctors do to try to get immunity in kids or in adults, like in the last 2.5 years, why it does not make any physiological sense. But we'll talk about why this whole thing over the last 2.5 years has been a complete and utter failure, why there's been so many people injured as a result. We'll give you the physiological reason why, but we'll also show you here is how you can start to test the barriers, the innate immune system, and the adaptive immune system, and that comes up with the plan to make your immune system strong again. Guys, go up to the very top of this page right now if you're from the Chicagoland area, and go ahead and get registered for that talk. Space is limited to 40 people. We have people registering right now on my phone as I speak, and so make sure that you get registered for that event. It's going to be an awesome time. But Dr. Nate, I have things going on that day. I do too, but I think it's still important to actually put those other things on hold in order to teach you something that has the impact to affect you for the rest of your life. Because at the end of the day, ask your kids, hey, do you want mom or dad to have cancer, or do you want me to be at your 19 games that you have this weekend? And that's a tough, tough proposition. I know it's important for you, but you got to think not only just for the right now, but you also got to start thinking about your future. So make sure you get registered for that event. So guys, be well, be blessed. If you're watching again, make sure you go ahead and hit replay. Let me know where you're watching from. And as always, guys, please share this video because it can impact someone who needs to hear this message. And as always, when you share, I am forever and eternally grateful. So guys, I hope you have a great Monday. Be well, be blessed. Remember who you are.